Hello. Hello. Everyone, sorry for the delay. Sorry for the delay. Sorry for the delay. Okay, so we're going to start today's program, all right? Namaste, everyone. Namaste, everyone, and good evening to the fellow participants from from Nepal, and good afternoon to our speaker. It is an immense pleasure to welcome you all today on our Career Campfire Season 2, Episode 2, brought to you by Standing Committee on Veterinary Education, SCOVI at IVSA Paklihawa. Introducing myself, I'm your today's meeting host. I'm Vikyan Karki. I'm a second-year veterinary student here at IVSA Paklihawa. I'm a member of IVSA Paklihawa, and I'm also the Standing Committee on Animal Welfare Coordinator. All right, so today's topic of discussion will be some of the more common cases of equine diseases in the UK. IVSA has been a great platform for us to connect with and learn from various engineers worldwide. Utilizing the same today, we have invited Ms. Rosie Meynell as our speaker. She is a fifth-year veterinary student at Wrocław, Poland. She's from the Wrocław University of Environmental and Life Sciences, and she's also the IVSA member from over there. Similarly, moving on to the more formal part, I would like to request Mr. Sujit Raimi to take the place of chair on today's program. Now, similarly, as guest, we have the president of IVSA NPI, Mr. Achut Acharya. Now, moving along, I would like to request our today's our Mr. Anurag Silwal to provide his welcome speech. Mr. Anurag Silwal, are you there?
Hello.
Okay.
Thank you, Vigyan. So, warm greetings, everyone. Am I audible? Hello.
Yes, you are audible.
Okay, thank you. So, warm greetings, everyone. I am Anurag Silwal, Public Relation Coordinator of IVSA Paklihawa, local chapter under IVSA Nepal. It's my immense pleasure to welcome you all on today's episode 2, season 2 of Career Campfire. Career Campfire is a regularly organized program by IVSA Paklihawa, targeting the veterinary internship students to gain knowledge on related topics of related field. Last year, we concluded season 1 of Career Campfire. In that season, we had total of 5 episodes. This year, we have started the season 2 of the Career Campfire with the technical knowledge about the commonly used veterinary medicines given by Dr. Bevina Pandey 2 months ago. So, continuing that, today we are here for the second episode of Career Campfire. Today we have Miss Rosie Meynell, who will be discussing the case study on some of the most common equine diseases which are generally seen in the UK. I would like to thank our honorable speaker, Miss Rosie Meynell, for sparing some of her time for this program despite her busy schedule. I believe this program will be full of learning and hope everyone's query will be fulfilled by the end of the session. At last, myself, Anurag Silwal, would like to welcome you all again in this program. Happy learning. Thank you.
Thank you, Anurag Silwal, for your short and sweet welcome speech. Now, without any further delay, I would like to ask our speaker, Rosie Meynell. Rosie, are you there? Okay, now I'd like to hand over the stage for Miss Rosie.
Hey everyone, I'm Rosie. And I'm just going to be telling you all a little bit about some equine diseases in the UK. So without further ado, let me share my screen. There we go. Can you all just let me know if that's working okay? Yeah, is that all right? Okay, cool.
Yeah, looks good.
Right, let me get started then. So, I'll be talking about common equine diseases in the UK. First, a little bit about me. So, I'm Rosie, and you reached out to me and gave me this amazing opportunity, so couldn't say no. I'm from Scotland, actually, but I study in Poland, so I'm not Polish. I'm in 5th year, so I've been out in Poland for 5 years studying abroad. I'm also a member of IVSA and SCOVI. So I've been involved with horses my whole life, and I've volunteered at Team Ranch Scotland for the last 8 years. Fun fact, Team Ranch is a global chain, and there's actually a Team Ranch in Nepal as well. So I've been hoping to go and visit one day. I think that I want to work with horses, and I'll probably go back home to the UK. So here is some cases that I have experienced on my work experience and just through working with horses back home in the UK. So let's go on to our first case. So this is Dylan. He is a 12-year-old Welsh pony, so that's a kind of a native breed for the UK. He's about 12 hands high, and he's used for children's trail rides. So he's presented to the vet with sudden onset of lameness in his front feet. So his owner reported that Dylan had been grazing on a really lush spring pasture, with really rich grass for the past week before this lameness started. So when the vet arrived to look at him, Dylan was visibly uncomfortable and reluctant to walk. So he had severe lameness on his front limbs. So upon clinical examination, Dylan's vital signs were normal. So, his respiratory rate, his blood pressure, his heart rate, his temperature, all those kind of standard things, they were all normal. The big thing was his front feet showed signs of lameness. So when the vet palpated the feet, you could feel a strong digital pulse, and the hoof walls felt hot. When he stood, he displayed a rocked back stance. So Dylan actually shifted his weight onto his back legs, like you can see in this picture, to alleviate the discomfort in his front feet. So the vet performed some hoof tests, and there was a positive pain response to pressure to the sole of the front foot. So this is where it gets interactive, guys. So I need you guys to think about what could this be. I started out quite easy, so hopefully this is a disease that you're seeing in Nepal. Would you guys have any suggestions? What's wrong with Dylan here? Go on, shout them out. Nope. Okay. Nobody has any suggestions? That's okay. I'll move on then. So Dylan has acute laminitis. So laminitis is inflammation of the laminae, sensitive tissues within the hooves, leading to pain and potential structural damage. So laminitis can be acute or chronic. In this case, it was acute, and this sudden onset was triggered by the high consumption of sugars from the rich pasture, which would have caused a metabolic disturbance in Dylan's system. So, any treatment recommendations? I won't let you guys guess. Prescribe painkillers such as non-steroid or anti-inflammatory drugs. So these are used to help manage the pain and inflammation. You would get a farrier to trim the horse's front feet to alleviate the pressure on these affected areas. You'd want to restrict the diet because this is what caused it in the first place. So we want to take away the inciting factor. We want the horse to reduce their intake of sugars and starches. So in Dylan's case, we switched into a low energy, high fiber diet of soaked hay and controlled grazing in a smaller, less lush field. In this particular case, we gave him something called a starvation paddock. So we cordoned off a small section within the larger field, just so he had limited grass access. This can be done if you, for example, cannot move your horse into a less lush pasture. If you're in an area where all the fields are lush, this is an easy alternative. Finally, you'd want to put Dylan on a period of box rest with deep bedding to really be gentle to his feet, and you want to minimize movement because you don't want to keep him doing trail rides and walking for hours and hours on the harsh ground if his feet are really sore. Once he's recovered, you can then bring him back into work. So, case 2. This is Buck, and he is an 11-year-old thoroughbred cross-Dutch warm blood gelding. So he's kept in a large livery yard with 80 other horses, and he travels often to competitions across the country. So recently he traveled abroad and was transported in the same method of transportation with several other horses, and all these horses came from different places. You didn't know their history. They were all mingling together, and most importantly, these horses all shared the same water source during the duration of travel. So first of all, Buck's owner became worried when he didn't eat his dinner one evening after he arrived back from the competition. So her first thought was colic, so she called the vet out. But the vet said, no, this is not colic. There's only minor clinical signs. Yes, he's not got an appetite, but he's only got a slight fever and a small amount of nasal discharge, and he had a lowered neck. It was not colic. You should keep an eye on him, and I'll come back in a few days and let me know if anything gets worse. Disease development. 2 days later, the owner called the vet out again. So Buck's condition had got a lot worse, and this time even she could tell it was definitely not colic. So Buck had some thick, yellow, purulent exudate coming out of his nostrils. He had severe swelling of the larynx and guttural pouch area. Upon closer inspection, it showed that the submandibular and retropharyngeal lymph nodes were really, really big. Normally you wouldn't be able to palpate them, or if you do, they'd be very, very small, but they were significantly enlarged in this case. Large growths had appeared on either side of his head. On closer inspection, they were actually hot to the touch and they were filled with pus, so these were abscesses. Buck was also having a lot of difficulty swallowing, and he was also having a lot of difficulty breathing. Not just difficulty breathing, but he was making this gurgling noise on inspiration. So the vet then came to the conclusion that this was actually due to airway obstruction from these large abscesses and lymph node lesions. So it had got so severe that Buck was actually struggling to breathe. So lab tests, the vet took some swabs from Buck's nose and nasal discharge. So she sent them away to the lab for microbial testing. 3 days later, the results came back, and the agent that caused this disease was Streptococcus equi subspecies equi. So I'm going to be interactive again, and hopefully you guys come up with a solution. What do you think this disease is? Again, hopefully it's something you see in Nepal. So do you guys have any suggestions for what this disease could be?
Is it big head disease?
Okay, so you guys clearly maybe don't know what this disease is. Maybe it's not a thing in your part of. I'm still a student too, but that's all right. Maybe you'll be a bit more interactive with the next one. So this disease is strangles, also known as equine distemper. It's a very infectious disease caused by the bacterium Streptococcus equi subspecies equi. So this affects the respiratory system and leads to the formation of abscesses in the lymph nodes, particularly in the head and neck region. So this disease is spread by an infected horse when nasal discharge or pus from the lymph nodes contaminate pastures, feed troughs, brushes, bedding, tack, etc. So immediate actions. What would you want to do ASAP, taking into consideration it's a very highly infectious disease? So first of all, you want to get Buck away from all the other horses, okay? he's already shedding, you know, he's already got this disease, you know, even just from the time between arriving back and the time of diagnosis, you know, it took 3 days for the results to come back. He's probably spread it everywhere. So your immediate actions are to get him away from the other horses, okay? You want to isolate him in a stable, his stable mates, you know, the horses in the stables next door to him, you want to move them far away. All the shared equipment like grooming tools and poop scooping tools and feed buckets and tack, you want to disinfect everything, door handles, windows, everything, thorough disinfection. Make sure Buck has his own separate equipment to use. The paddock that if he was turned out in a paddock since returning back, you want to leave that empty for a month, because you can't disinfect paddocks in the way that you can disinfect surfaces and equipment. So the only thing you can do is leave it for a month, and that's the incubation period of this bacteria. You know, it's a safe margin to leave. So that's why we say 4 weeks or a month. And most importantly, because it's such an infectious disease, the other horses that Buck had come into contact with, either indirect contact or direct contact, you're going to want to test those horses too. In this case, luckily, they all came back negative, but that may not happen in the real world. So treatment. Over the course of his infection, Buck was kept under close watch. You know, he was suffering from really severe symptoms and he was struggling to breathe. So this was a very high risk case. So luckily, he had his fever decreased. His owner drained and flushed his abscesses, for example, with a diluted antiseptic such as 2 to 3% povidone iodine solution. A nice thing to do for the horse would also be to give them daily hot compresses on the swollen lymph nodes, which would help them shrink down and soften, which again would help with speeding up recovery. For strangles, funny fact, you don't want to give them antibiotics, even though it's a bacterial infection, because if you give them antibiotics, this can increase the risk of complications and make reinfection in the future more likely because it decreases their self-immunity. And it's just, you know, the drugs do the work for them. So it actually makes it more likely to get infected in the future. Luckily, these severe symptoms resolved over the course of the next 6 weeks. So Buck made a full recovery, even though we were worried about him to begin with. So in Buck's case, the reason his symptoms were so severe was because he was actually not vaccinated. So strangles vaccinations, if they're available in your part of the world, are definitely worth getting because they can really, really help decrease the symptoms, because horses can easily die from strangles. So it's a very preventable disease. She's a Shetland pony. Shetland ponies are from Scotland, actually, which is the part of the world that I'm from. They're tiny little ponies, you know, they're under 10 hands high, they're very short, they're very prone to obesity. So Daisy here is a 12-year-old Shetland. She was presented due to concerns about weight gain, excessive fat deposits, and abnormal hoof growth. So Daisy had been on a restricted diet, so we're not thinking, you know, we're thinking it could be laminitis, but it could be something else causing that because her weight is still increasing despite the restricted diet, and she's also got recurrent laminitis. So yes, laminitis is going on in her case, but at this point, you know, using our vet critical thinking brains, we've got to think, right, perhaps there's something else at play here. Perhaps there's something underlying all these incidents of laminitis. So on physical examination, Daisy was very overweight with a BCS of 7 out of 9, and she had localized fat deposits on her tail head, ribs, behind the shoulders, and her neck was very thick and cresty. So with a horse's neck, you put your hands on your neck, and if you can kind of move it, that's pure fat. It's pure fat. So horses with a thick, fat, crusty neck, this is something that's not normal. This is something you should be worried about. You should be starting to think about preventative measures, because overweight and obesity are likely to develop conditions, not just laminitis, but also this condition and some more that I'm going to talk about. So whilst Daisy had signs of laminitis, she also had something that you wouldn't see in laminitis, and that would be elevated insulin levels and alterations in glucose metabolism. So there's your big hint there about what this disease is. So think about a really common disease in human with high insulin levels and altered glucose metabolism. That will give you your kind of hint. So I won't let you guys guess this one, but hopefully you're thinking about it in your heads. So the diagnosis for Daisy here is equine metabolic syndrome. Now, I'm not sure what the prevalence of this would be in Nepal, but in the UK, this is quite a common disease because there's lots of fat ponies in the UK. So, based off the clinical signs, the BCS, the history, and the blood work, we diagnosed Daisy with EMS, equine metabolic syndrome. So this is a metabolic disorder similar to type 2 diabetes in humans, and it primarily affects obese horses and ponies. So it's characterized by insulin dysregulation, abnormal fat deposition, and an increased risk of laminitis. So the exact cause is multifactorial, so it could be multiple factors causing EMS, including genetics, diet, and a lack of exercise. Treatment for Daisy. So what you want to do, first of all, is diet. So like with laminitis, you want to really restrict access to rich diets. So you don't want them on the lush grass. You don't want to be feeding them grain concentrates. And to be honest, with horses such as Shetland ponies, they don't really need feeding. They can live off grass. In the UK, we have a phrase saying they're good doers, which means that they can have air and put on weight. They really don't need extra things such as concentrates. So with Daisy, she was put on a controlled diet. All she got was soaked hay and a couple of mineral and vitamin supplements. Now, I don't know if you guys do soaking hay in your part of the world, but we do that over in the UK because hay, especially if hay is made from grass that's high in sugars and things like that, if you soak that hay, it draws out the sugar. The water draws out the sugar, and it just makes it less rich for the horse to eat. And it's also good for horses with equine asthma because it gets rid of all that dust that can incite that. So with Daisy, we gave her some soaked hay and some supplements as well. Also, you just want to make sure you're managing and monitoring the horse's food intake to promote this weight loss journey. Also, exercise. So she might be small, but she still needs to be ridden. You know, Shetland ponies are really good for children. So if Daisy's owners had children, this would be perfect. If not, you should be taking her out on the lead rein, giving her regular exercise. Just introduce it gradually. You don't need to start kicking her up a regime, going on hour-long canter rides every day. Just something gentle to get her moving, just to help the metabolism kickstart. Sometimes we also use medication to help manage EMS. So this medication can manage insulin regulation, just like with humans. You know, every case is different though, and the vet needs to make their own judgment based on the individual circumstances. And again, progress monitoring. We want to monitor that body condition and the blood work, and also for signs of laminitis, because they're the kind of trio of most important things to be looking at here in the case of EMS. So case 4. This is Lucy. She's a 6-year-old thoroughbred mare. She was brought in with signs of lethargy, weight loss, and poor appetite. So just to define lethargy, person might be feeling kind of tired and lack of enthusiasm, especially a thoroughbred. You probably have thoroughbreds in Nepal, but you know, they're quite active horses. You know, they are the racehorse breed. So a thoroughbred being lethargic, you're instantly going to start to go, right, there's something up. This is not normal for a thoroughbred to be behaving in this way. Weight loss on its own is, again, it's not as big of a sign because thoroughbreds are quite skinny horses and they do struggle to put on weight, unlike Welsh ponies and Shetlands. But anyway, you know, these signs off their own, you would be a little bit worried. But the big thing in here in the presentation that we're worried about is the owner reported that Lucy had been grazing in a pasture where ragwort was present. So upon examination, Lucy was dull and had a body condition score of 3 out of 9. Now that's skinny even for a thoroughbred horse. So she'd lost a lot of weight recently. She also had jaundice of the mucous membranes. So in simple terms, that's yellow gums. The mucous membranes should be pink. They should not be yellow. So instantly, if you see yellow mucous membranes, you're going to think, oh, that's something wrong with the liver. That's usually 9 times out of 10, yellow mucous membranes is going to be caused by liver dysfunction. So we did bloods, revealed elevated liver enzymes as well as elevated NH3 levels. So right, instantly we're thinking there's something wrong with the liver, perhaps it's liver failure, but we need to find the cause. So again, diagnosis, the big thing for this, the big thing that stood out, I don't know if you guys realized, but the one thing that stood out, apart from all these general signs, was ragwort. Okay, Lucy the horse had been grazing in a field with ragwort in it. So I don't know if you have ragwort in Nepal, but it's a big problem in the UK. It's really, really severe. Ragwort is found in fields where horses are grazed. You're supposed to pick it up and get rid of it if you see it growing in the field, but it's tough to get rid of. You know, it keeps coming back year to year. You can spend hours every week pulling out ragwort and it still won't be gone completely. Ragwort is so bad is that it contains hepatotoxic pyrrolysine alkaloid toxins that are metabolized in the liver to toxic metabolites, which cause liver damage and It causes liver damage and manifest as symptoms like weight loss, lethargy, and loss of appetite. So as a result, the horse can develop liver failure and death. So horses are the main animal affected by ragwort toxicity, but also sheep. It's a big thing in sheep as well. So those are the main two animals that suffer from ragwort poisoning. So to control ragwort, we really need to keep on top of those pastures. It's hard, but you really need to manage the pastures, pull up all the ragwort. Don't just cut it. You need to get in, dig. You can see in this picture here on the right-hand side of the screen, you can see the ragwort fork, and that's a tool that we use to really dig in the ground, dig up those ragwort plants. You can also use herbicides, but if you use herbicides, you've got to be aware if there's horses in the field, that could easily go wrong as well. And you could poison the horses with the herbicides instead of the ragwort. So you've got to figure it out for yourself, see what the situation is and what's the best way of removing it for you. So how do you treat ragwort poisoning? Well, first of all, this horse's liver is failing, so you need to look after the horse before you even think about that field. So you need to give the horse supportive care. You need to combat that liver damage and make sure the horse doesn't die, because horses can die from ragwort poisoning. So you want to give them IV fluids, nutritional support, and medications that will help the liver recover. Because as well as causing liver dysfunction, it can cause cirrhosis. Now, cirrhosis is scarring of the liver. So this is a permanent change, and it means that the horse's liver, even after they recover from the acute form of ragwort poisoning, they can still suffer from chronic liver cirrhosis, which is a big deal in the future. Medications to enhance liver detoxification and help eliminate the substances from Lucy's system. Lucy's progress was closely monitored, including regular blood work to assess liver function and overall health. So what you need to make sure, once the horse is okay, you need to educate the owner on ragwort, because sometimes people might just go, oh, it's a pretty yellow flower. What harm can it do? But you need to educate owners as vets. That is our responsibility, to educate them on the signs of ragwort toxicity, and also just to keep on top of those pastures and make sure the ragwort doesn't grow. So, case 5. This is Denver. He's a Clydesdale gelding. And he presented with signs of intense itching, including rubbing, scratching, and hair loss, primarily around the mane, tail base, withers, and belly. So upon clinical examination, he had exorciation, erythema, and crusting in the affected areas, with no secondary bacterial or fungal infections. He also had a history of sweet itch during the summer months. So again, very self-explanatory. This horse has sweet itch. So sweet itch is also known as seasonal recurrent dermatitis, summer itch, or coulicoids hypersensitivity. So this disease is a hypersensitivity reaction to specific allergens that you can get in the saliva of coulicoids midges. So when the bugs bite, their saliva is transmitted into the horse. And normally, you know, for us and for most horses, you go, oh, it's a bug bite. You know, maybe it's a little bit itchy, but it's no big deal. But sometimes horses have a really hypersensitivity reaction, which means that they have, you know, swelling and alopecia, and it's a lot more serious. And that's when you start to worry about it. So this hypersensitivity response is mediated by IgE immunoglobulins produced by the horse's immune system, and these bind the allergens, causing a cascade production of histamine and cytokines. And that's what in vet school as well. We spent, you know, half a year learning all about the inflammation cascades. So yes, very important information to know. So anyway, histamine is the most important part of this cascade, and it appears in the initial phase of reaction. So diagnostic workup, we should know this instantly by hearing that Denver has a history of sweet itch. You know, don't go looking for zebras when there's a horse in front of you is a phrase that we say, literally. So if a horse says, if the owner says that their horse has history of sweet itch, think, oh, maybe it could be sweet itch again. Don't go looking into all these fancy diseases before you've ruled out the normal common diseases. So that's what I'm talking about today, common diseases, right? So Denver has a history of sweet itch, which makes it the likely diagnosis. But again, you just want to confirm that without, because you don't want to say to the owner, oh yes, definitely sweet itch again, before you have proof. So you want to confirm the diagnosis and also rule out possible causes. So first of all, take the history, medical history, feeding, exposure to insects. That's the most common, exposure to insects, and I'll get onto that in just a second. You can also, this is not mandatory, but it's recommended to do, you can get the horse to undergo intradermal allergy testing in the skin. You guys should know what that is. So that's how you identify specific allergens that trigger this sweet itch inflammation. So in this case, we did do that for Denver, and it confirmed hypersensitivity. Again, you could do skin scrapings and fungal culture tests just to make sure there's not bacterial or fungal skin conditions that could be causing it, or even things like mites, like parasites like those. So you just want to rule out any other causes of alopecia and dermatitis, because you guys probably have dermatology as a subject too, right? There's so many causes of dermatitis, so many causes. So you just want to make sure it's nothing else nasty going on there. You can also do blood work, that's recommended too. So complete blood count, which tells you the proportions of red blood cells and white blood cells, etc. And also serum biochemistry, because you want to make sure that there's no other like liver enzymes that are high or anything, because there's other forms of poisoning, not just ragwort poisoning, but other ones that liver damage can also, as well as manifesting as liver damage, they can also manifest as dermatitis and skin diseases. So a tip that I've learned is that if your horse has skin diseases and there's no obvious cause there, always do serum biochemistry, because you want to learn about those liver enzymes as well, just to make sure there's nothing there causing that, because you might not think liver and skin are related, right? But actually they're a lot more related than you think. So skin problems can be a manifestation of liver problems. So treatment for sweet itch, this picture here is me treating the Clydesdale here with a sweet itch. I'll tell you what the medicine is in just a second, but first of all, we're going to talk about environmental modifications. So first of all, the kind of summary of environmental modifications is you want to limit the horse's exposure to bugs, because if they're having a hypersensitivity reaction to the bugs, you want to limit their exposure to bugs. So that means keeping them inside during peak insect hours, which are dawn and dusk. You want to put them in a fly rug. You want to make sure that bugs can't get into the barn. You also want to groom the horse daily using a soft brush or a damp cloth. Now, the reason that I say soft brush or damp cloth is because you don't want to irritate the horse's skin by using more harsher methods of grooming. Now, for medical interventions, it's a really good idea to use an anti-inflammatory soothing cream, such as corticosteroids, just to apply that to the areas, and the horse will feel so much less itchy. Because, you know, when horses are itchy, they rub up against everywhere, and it's not, the more damage is done by the horse itching than by the actual reaction itself. So you want to make sure the horse isn't feeling itchy, they're not suffering from pruritus. You can also give them, as well as the topical cream, you can also give them pills with their feed containing antihistamines and corticosteroids. Through intradermal skin testing, you can also, now this is not very common at all, but I thought I'd just include it because allergen-specific immunotherapy. So you can do subcutaneous injections of increasing concentrations of allergens. So it's basically exposure therapy. So you build up their tolerance. So a tiny amount, and then more and more and more over time. Like with this is Ralph. He might look a little bit funny, but we'll get on to the reason why he looks like that in just a second. So he had a variety of clinical signs, including a long, curly coat that doesn't shed properly, sweating, had recurrent infections, laminitis, and weight loss despite a good appetite. Now, think back to the first horse that we did that was a Welsh. He is a Welsh, even though he's only half, he is still. So you'd think, why is he so skinny for a Welsh horse? You know, what's making him lose his appetite? He had, polyuria and polydipsia as well. So based on all these symptoms, a good UK vet would have a clear differential diagnosis in mind. Now, this is a very common disease in the UK. Not too sure what it's like in Nepal, but I thought it'd be interesting to see if you guys know what it is. So the clear diagnosis that we can establish in Ralph's case is Cushing's disease. Now, Cushing's disease is also known as pituitary pars intermedia dysfunction. Now, this is a chronic progressive condition caused by an imbalance in the hormones produced in the pituitary gland, which is located at the base of the brain. So horses with PPID don't produce enough dopamine. So the pituitary gland becomes unregulated and releases so many hormones, far too many hormones. So then the body's whole hormone system just becomes completely messed up. So if the dopamine is too low, the pituitary gland is, overproducing random hormones. These hormones are essential for maintaining body functions, but if it's overproduced, then things like hair and sweating are overproduced. So basically, the body's metabolism is just going crazy. So this disease affects horses and ponies that are older, so over the age of 15. And recently, in recent years, horses do live for longer. We all want our horses to live as long as possible. So therefore, just like things like cancer, the older the general life expectancy is, the more prevalent these diseases will become. So what do we do for our diagnostic workup? And this picture here, by the way, you can see how long and curly this horse's coat is. And I know that there are some breeds out there that naturally have coats like this, but in Arab horses and in Welsh horses, this is not common. So instantly, this is a characteristic sign of Cushing's disease. So to confirm our diagnosis and assess the severity of Ralph's condition, first of all, we should take a clinical history and do a physical examination. So we want to learn about his health, feeding regimen, exercise routine, and any changes in behavior or physical appearance, such as the coat becoming curly. We also want to do hormonal testing, so blood samples to measure his level of adrenocorticotrophic hormone, or ACTH. Now, this hormone, this is something to be aware of. This hormone naturally rises a little bit in autumn time and springtime. Now, these are natural. All horses will have slight elevated levels of this hormone, no matter whether they have Cushing's or not. However, if the levels are consistently high, then we should be worried that, okay, this horse might have Cushing's. But if you do bloods on your horse and, there's nothing else slightly high in autumn, don't go thinking, oh my gosh, this horse has got Cushing's, because it probably doesn't. It is a natural thing to be slightly higher in those seasons of the year. Additional tests that we can also do, so we can do complete blood count again, just to check for infection, serum biochemistry, and radiographs, just because laminitis and Cushing's go hand in hand, and you know how laminitis works, right? So the coffin bone rotates, and you can do radiographs just to assess the severity of the laminitis progression. You can also look at organ damage as well, because if it's a chronic case of Cushing's, there will be organ damage. So finally, treatment. First of all, medication. So pergolide is the drug used to treat Cushing's disease. So the most common form, or the most common brand selling pergolide, is Prashend. Personally, Ralph is on one pill of Prashend every second day. So pergolide is a dopamine agonist, which means it acts in the same way as dopamine. So it's basically like a synthetic dopamine. So that helps regulate this excessive hormone production. So Ralph also suffers from laminitis, so he also received non-steroidal anti-inflammatories just to alleviate that discomfort and inflammation. But if the horse does not have laminitis, you don't want to give them that. It's just if they have laminitis as well as Cushing's, because they do go hand in hand. Diet and nutritional support. So you want to, again, just like with the diseases we discussed before, like EMS and laminitis, limit that sugar intake. Take them off the rich grass. You want to soak that hay. You don't need to give them feed if they don't need feed. You do also want to give them some minerals supplemented into their feed, like magnesium and chromium, because as well as supporting metabolic function, these will also help regulate those insulin levels, because you want to try and get the horse's metabolism back to being as regular as possible. And finally, preventative care. Again, because laminitis comes hand in hand, or even if they don't have laminitis, they still are highly likely to develop hoof issues. So you just want to trim those with a farrier and address any hoof abnormalities that present during this time. You also want to receive regular vaccinations and deworming, just to make sure there's no immune problems that could be going on. Right. that's everything for today. Hopefully you guys learned something about common equine diseases in the UK. Let me know if you have any questions, but if not, then I just want to thank you all for listening to me, and I hope you have a great rest of the day.
Thank you, Miss Rosie. That was a very sweet presentation, very insightful. Yes, indeed. We learned 9 diseases, right? Yeah. Now, I would like to ask if there is any questions among the audiences. If there is, then I request you to unmute yourself and go ahead, or you can leave it at the chat box and I'll read it out for you.
Hello, Vigyan. I have one question which I wanted to ask Miss Rosie. So, hey, Miss Rosie, just wanted to say a big thanks for your awesome presentation on equine diseases. I have a small query regarding one of the equine diseases. So, mastitis is one of the major problems among cattle or ruminants here in Nepal. So, I just wanted to ask, how common is mastitis seen in case of horses? Can you please enlighten?
Mastitis in horses?
Yeah.
To be honest, I've never encountered any cases of mastitis in horses. I've only encountered it in cows, and I'm sure it's just as prevalent in the UK as it is over in Nepal, but I've actually never encountered it in horses, so I can't tell you about the prevalence. I'm sorry.
Okay, thank you.
Okay, moving ahead. Any more questionnaires? And no questions? You can unmute yourself and go ahead, or you can leave it at the chat box. Please hurry, because I have a lot of questions myself.
I don't think we have any questions, but Prashant, if you want to ask me any questions, you're more than welcome to.
All right, I'll go ahead. And my name is Vigyan. Actually, the Google Meet it logged into my uncle's account, and I couldn't change it. Okay, so I'll ask you some typical questions. All right. Starting with, how difficult is it to handle horses? Restrain them during these treatments. How difficult is it?
So generally during these treatments, the horses are quite laid back. In the case of strangles, the horse is obviously going to be a lot more stressed in this case because they can't breathe and all this, and you're going to be worried about spreading the infection. So you do have to take that into account when handling the horse. You're going to want to be wearing gloves. You're going to be changing those gloves. You're going to be doing disinfection of your hands and all your equipment between cases. But just generally, these horses are quite laid back. In my personal experience, a lot of these cases have been at the ranch where I work at, and they're all very relaxed horses anyway. But I think in general, the horses are quite relaxed, unless they are breeds like thoroughbreds, which, they might be a bit more highly strung. But the native breeds such as Welsh ponies and Shetlands are very, very calm. They might be a bit cheeky, but they're generally quite calm, yeah.
They sound like fun animals to treat now. Am I reading too much? No? Is it constant or is it free? It's not on. Oh, okay, sorry. Looks like I can't do anything about it. So I'll go. Okay, there are questions. Sachin Shrestha is asking how horses are important in the zoonotic point of view. Okay, so in terms of zoonosis.
I think there are a lot of significant zoonotic diseases in horses. We do have some, notifiable and reportable diseases. However, I think generally the UK is quite good, and they do have lots of strict protocols on spread of diseases. Like I mentioned with the strangles, they have guidelines of what to do if an infectious disease reports out. So, and in terms of zoonotic diseases, there aren't very many significant zoonotic diseases. You have things like rabies, but again, rabies would be more commonly, from carnivores than horses. So generally, no. I know dermatophytes and fungal diseases such as ringworm are likely to have got to get from horses. But apart from dermatological diseases, generally, no, horses aren't that important zoonotically.
Thank you. The next question is from Sujit Regni. How common is intestinal obstruction in equine species?
Okay, so yeah, colic is a big thing in horses. I deliberately didn't talk about colic because A, it's not just exclusive to the UK, you can get it everywhere in the world. But yeah, colic is huge, it's very common. You know, if a horse eats too fast or if a horse rolls over the wrong way, it can get colic. Like, you know what horses are like. They're trying to die the whole time, and colic is one of the biggest diseases of horses. So yeah, it is very common in horses all over the world, students.
Okay, I'll go into one that I have on my own. The antibiotic that you said related to strangles, no? The antibiotic of you avoid the antibiotics in case of strangles. So is the avoiding done in every other bacterial cases or in just strangles specific?
As far as I'm aware, it's just in strangles cases, and you would generally think that with bacterial diseases, yeah, you'd want to avoid and you want to use antibiotics, but I saw this just in this really just for strangles as far as I'm aware. But yeah, I thought it was really interesting. It stood out to me, so that's why I thought I'd include it.
Okay, so the points that you write in exams. The next question is from Saurabh Bastala. Can conditions like bloat occur in horses too?
Okay, so as far as I'm aware, no, because bloat is a condition that affects cattle, and the reason that, oh gosh, this is testing my knowledge from class now, but bloat is a big thing in cattle because they have that rumen, which is their, cows have 4 different stomach compartments, and bloat's a big thing because of their rumen. They have this massive rumination chamber where all those gases are produced. I'm not going to get into the specifics of bloat because you can look that up, but generally in horses, because they're monogastric animals, you wouldn't get it as much. Just like with dogs, they might get conditions such as gastric dilation and volvulus syndrome. However, generally it's not as big of a deal. Apart from colic, you get your strangulation and intussusception. Apart from that, generally no, it's not as big of a deal in horses as it would be in cows.
Mr. Anil Sharma has a very specific question. Give some insights on the use of ozone therapy for laminitis in horse.
Interesting. You know what, Anil Sharma, that's a really interesting question because I've never heard of ozone therapy being used for laminitis. But having seen your comment now, I'm actually going to go and do some research on that because that sounds like a really novel way of treating laminitis and it could be really handy. So thank you for bringing that to my awareness.
Ms. Rosie is thankful herself. Moving on to the next question. The EMS, you said the metabolic one, yeah. Is that and laminitis, correlated? Like, does every EMS cause laminitis and every laminitis syndrome is related to EMS and vice versa? Or is it like specific?
That's a really good question, actually. So EMS, equine metabolic syndrome. So laminitis has lots of different causes. It could be caused by glucocorticosteroids. It could be caused by, metabolism. So if the metabolism is dysregulated, like in EMS, then yes, that could cause laminitis as a result. There is a high degree of correlation together, and yes, to some degree there is some causation, but again, not all laminitis cases would be EMS, and not all EMS cases manifest as laminitis too.
Thank you. Pradeep Saha is asking a question: how the cases of food poisoning are handled in equine? Okay, so food poisoning.
Do you mean like toxicity to do with plant toxicity and things like that? Well, then in that case, generally you would kind of do it in similar ways as to, I said, the way that you would treat ragwort. So as well as the mental side, so you want to, again, reduce exposure and make sure it doesn't happen again kind of thing. But in terms of treating the horse suffering from the poisoning, Again, it's the same principles. You want to make sure the horse gets that supportive care. You want to make sure that they don't die as a result of liver failure or anything like that. A lot of poisonings do manifest as liver failure because the liver is that organ that processes all the toxins that enter the system. So yeah, a lot of it, they're handled in the same way as ragwort poisoning.
Mr. Min has a question. We have heard about, okay, so this is a specific one. We have heard about wobbler disease. How is this condition over there?
Oh, okay. So Wobbler's disease, we learned a lot about that actually in class here. So it's a thing in Europe. I think specifically in the UK, yeah, it would be present. But again, it's not one of the more common diseases. But yeah, it is present in the UK, and it is a thing, definitely. I think in the US though, we've done a lot of case studies and learning about it present in the US. So that's probably where you would see more cases of wobblers.
I have a question, the Robert now. Is the entire plant poisonous, or just some part of it, like the flowers or stuff?
For ragwort poisoning, yeah, the whole plant is poisonous. Actually, so ragwort, yes, it can grow in the fields. That's where it grows. However, it actually tastes really bitter. Like the flowery part tastes bitter, so the horses generally won't eat it unless they're really stupid, as horses sometimes can be. But more commonly, ragwort poisoning is actually ragwort grows in the fields where long grass that's used for hay is cut. So ragwort is cut along with the hay and it's dried. And once the ragwort's dried out, it loses that bitter taste. So yeah, ragwort poisoning is a lot more commonly done through the hay. So yeah, it is generally the whole part of the plant, yeah.
Thank you. Babu, okay, so we have another question. How about Monday morning sickness in equine?
You know what, Babu? Monday morning sickness doesn't just affect horses, it affects humans too.
Good work humor over there. So do all horses get sweet itch, and the irritation by the sweet itch is is it localized, or it occurs like all over the body?
Okay, so sweet itch, yeah, all horses can get it. The factor that kind of leads to sweet itch occurring is, it's a hypersensitivity reaction. It's to do with the antibodies and stuff. So it can occur in any horse. There are genetic predispositions to it, but there's no one breed of horse that the areas that are more likely to suffer from sweet itch. Yeah, there are more areas, you get that, the tail head, the belly, the withers, the mane, the crest of the neck, the kind of pole of the head. So generally, when we're treating sweet itch, when we give them the drugs on the body, the topical, the cream, we generally do it at the pole, the mane, and also at the tail head. So those are the kind of most commonly areas. And again, you can think about a horse that's itchy, right? They would be itching their head, they're itching their neck, and they're itching the base of the tail. So those are the areas that you really need to make sure that you get, more importantly than the others.
Thank you. Anil Sharma is asked, what is done for pain management in horses? Pain management.
Well, there's a whole big section of textbooks just on pain management in horses. So that's far more than we can discuss just in one session here. But I'd recommend looking that up, getting it online. But I think some of the most common, there probably will be drugs that are to use and what works best for you. So that's something that you'll be learning yourself over time.
So Mastala is asking, can you please tell us some drugs that are seriously contradicted in horses?
Drugs that are seriously contraindicated in horses. Now that is testing my pharmacology knowledge, and I have not done that subject for 2 years. So really.
My final question is, the cause of Cushing's disease? No? Is it like entirely genetics, or it is related to tumors and stuff? Like, what are the causes of it?
Sorry, can you repeat the name of the disease there?
Cushing's disease, the one of the pituitary gland.
Sorry, what was your question about Cushing's disease?
The Cushing's disease, now, is it caused by genetic, like, is it by birth, or some tumors triggers it, or like, what are the causes?
Yeah, well, generally there can be, it can be tumor related. Again, tumors in any part of the body can cause literally anything. Yeah, there can be genetic predispositions as well. I think generally though, because it's something we see in older horses, it seems to just be more of a degenerative change. That part of the brain starts not failing, but it stops doing its job as effectively. So it seems like more of an age-related change that other things might help cause. But I think the main cause of Cushing's would definitely be, just due to the age-related change.
Okay, thank you, Rosie. That was very insightful for me especially. Now, I think let's end the question and answer session now, right? Ending the question and answer session. I would like to have a few words from you. What do you think about today's Career Campfire program?
I think it's been really interesting. To be honest, I was very flattered, and I was slightly surprised that you reached out to me because, I'm a SCOBY ambassador as well, actually, and it was our task a couple of months ago to go out and find people to give, vet talks. It's a project we have. It's like mini TED talks. And I suggested myself, and they said, no, we're only allowed speakers that are qualified vets, So to be asked to give a speech to you guys when I'm still a student myself, I am very, very flattered. So no, I think it's very interesting. I think for me as well, it's been a good opportunity to do some more research into diseases because yes, I may have learned about them in class, but again, preparing a presentation, it's one of the best ways to study, in my opinion, making sure all the information is correct and doing a lot of research. So yeah, it's been really interesting and it's been a really good experience having to do this with further presentations and work on my public speaking skills. So thank you all for having me, and I'm really, really flattered again. So thank you very much.
Thank you, Rosie, for that sweet and honest review. I would also like to welcome Dr. Rupak Pandey, our founding president of IVSA Paklihawa and currently the equine practitioner at Nepal Army. I'd like to welcome him as our guest. And I'll also like to welcome our ex-president of IVSA Paklihawa, Mr. Prakash Rahul. All right, moving forward, we have come to the end of the program. Dr. Rupak Pandey, if you have any words to spare for today's program, I would like to request you. Let's give him a minute, okay? No, sir, you are not audible yet. You're not audible yet. Let's give him a few more moments, okay? looks like the technical error persisted. It's okay. You can leave your message. You can leave your search with message in the chat box, and I'll read it out for you. It's okay. Okay, so marking towards the end of the program, I would like to request our program chair, Mr. Sujit Remy, to take over the stage and let down a few words. Mr. Sujit Remy, are you there? Okay, so Dr. Rubak Pandey has said, thank you, Dr. Rosie, found the presentation quite useful for my practice also. Hoping for your future cooperations. Regards. Okay, that's a very sweet message. Okay, sweet interaction over there in the chat box. Now I'd like to request Mr. Sujit Regni. You can take over the stage and formally end today's program. Go ahead.
Everyone and namaste.
Wait a second there.
Sorry, am I audible?
Yeah, you are audible there. Before the end, I would like to request everyone, after the end of this speech, I would like to request everyone to open the video, and we're going to take a small SS, all right? Just that. Okay, that'll continue.
Hello, am I audible?
Yeah, you are there.
Yeah, I would like to thank you all the participants for your active participation in today's webinar. It has been an enlightening and insightful discussion. On my for insightful presentation. Your case studies has created conclude this webinar here, and before that, please let's go. Okay, so I would like to request all for to open their camera, please.
Mrs. Rosie, are you there? We're not audible there. Okay, thank you everyone. Thank you for your presence. Special thanks to Ms. Rosie. Now let's end the program, okay?